Hey, we're often asked because we live in a military community right outside of Nashville in Clarksville, Tennessee, and there's a lot of retirees that are on TRICARE for Life, and they often will ask, do I need to have TRICARE and Medicare? In today's video, I'm going to walk you through exactly what you need to have if you have TRICARE for Life or you're a veteran without 20 years of service. Exactly how does Medicare and Medicare health plans integrate into your coverage with the VA or TRICARE for Life? Stick around, I'll be right back. Hey, often we are dealing with Medicare beneficiaries, especially here in Clarksville, Tennessee, the home of 101st Airborne Division. There's a lot of military folks that we are dealing with and they're talking about being on TRICARE for Life or VA. And then do I need to enroll into original Medicare? And then what other health plan options are really available to me on TRICARE? A lot of times there's a lot of confusion when it comes to Medicare Advantage or Part C plans. And in this video, I'm going to walk you through both scenarios. What happens if you're on original Medicare or not on original Medicare, you're on TRICARE for Life, going on to Medicare, and should you pick up Part A and Part B? Well, to answer that question, the question would be yes. When you turn 65, TRICARE is going to require you to go on original Medicare Part A and Part B. Now, the reason being is your Medicare Part A and Part B, which is going to be Part A is hospitalization. Again, you guys hear me say this often, but that's dealing with the hospital itself. If you go into the hospital, you're in a bed, you're eating the Jell-O, the nurse is coming to see you. And then there's some services outside of the hospital, like hospice, a skilled nursing facility, home health aid services that are skilled rehab in the home. Those fall under Part A as well. But typically, Part A deals with the actual building or facility that the hospital, whether that may be Vanderbilt Hospital or whatever hospital you're going to. That's Part A. Part B is going to be everything outside of the hospital. So that's like your doctor visits, your specialists, your outpatient procedures, your diagnostics. Things outside of the hospital fall under Part B of Medicare, which is your medical. So you have Part A, hospital, Part B, medical. And then that makes up Medicare Part A and Part B. So when you are turning 65 and you're on TRICARE because you worked for the military in 20 plus years of service and you qualified for TRICARE, and you've been on TRICARE since you retired from the military. You may have worked another job, maybe another career, maybe you're self-employed and mowed yards, whatever that situation may be, but you're on TRICARE and you're turning 65, you would enroll into Medicare Part A and Part B because Medicare is going to become the first payer. Then your TRICARE becomes the second payer of insurance. So it's going to process through Medicare first. With Medicare Part A, you're going to have a deductible. Right now, that deductible is a little over $1,700 for each hospital visit. And that's going to cover up to 60 days of coverage. And beyond 60 days, you have 61 through 90, you have a copay cost per day. Then 91 through 150, if you stayed 150 consecutive days, your Medicare is going to have, in a sense, high costs, but you're going to have a deductible and some costs per day after day 60. Now, that's going to push that bill over to your TRICARE, and your TRICARE is actually going to pick up 100% of that cost. On your Part B services, Medicare Part B is going to have a deductible. Right now, it's a little less than $300, and then you're going to have 20% billable rates. Well, once that deductible is not paid, it's pushed over to your TRICARE. TRICARE is going to pick that deductible up, and then the 20% billable rates for items that you have outside of the hospital is going to be pushed over to your TRICARE, and TRICARE is going to pick that up. So it works a lot like a Medicare supplement, even though it's not a Medigap or Medicare supplement plan. What Medicare doesn't cover, TRICARE is going to pick up. Now, legislation has changed a lot over the last several years. Years ago, when I got into the Medicare space, if you were on original Medicare and you had TRICARE, you went to the VA to access care. Well, legislation now has changed and allowed you to go outside of the VA to have a primary care doctor, a specialist, hospitalization, and things like that. Outside of the VA, you actually have the ability to access care. And I won't explain the details of that in this video, but you actually have the ability to go outside of the VA. Well, that does a couple of things. Again, your original Medicare is going to pay what it's supposed to. Deductibles and co-insurance are going to be pushed over to your TRICARE. TRICARE is going to pick up. So when you go to the doctor, if you're using original Medicare and you're using TRICARE, show both, and you're going to have your ID card for your TRICARE. They're going to process that through with your member ID number, basically on your VA or your TRICARE card. Now we're going to dive into what happens if I enroll into like a Medicare Advantage plan with my TRICARE. How do those two work together, and do they work together? And what benefit really plays in part for me when you choose to stay on original Medicare as a part to a Medicare Advantage plan and work along beside your TRICARE. So how does a Medicare Advantage plan work in conjunction with your TRICARE? Or let's say you're on just regular veteran that had 4 years of service and you had access to go to the VA for all these years, and you're going on to original Medicare, and you go on to original Medicare, again, you're going to go on Part A and Part B, and then your VA typically benefits going to pick up what's medically deemed necessary for your coverage for VA. Now, TRICARE and VA work differently because with TRICARE, you can also add additional coverages like dental, vision, and hearing. If you've had medical conditions in the military, and I won't get into the weeds with a lot of this, but like if you had a injury at war and medical conditions that are deemed part of your medical coverage, then what happens is you can be eligible for access of care for a lot of things with TRICARE and also VA. So understanding how your TRICARE works and what it covers, it's going to cover all your hospitalization and medical, but it also can extend and say, we're going to cover glasses because you had an injury at war that affected your eyes, or you're around chemical agents and it affected your hearing or your vision and things like that, then your VA and or TRICARE can cover that. So what happens if you go into a Medicare Advantage plan? Well, one, what is a Medicare Advantage plan? A Medicare Advantage plan is a private insurance company that has a contract with the federal government. The federal government allocates money to pay that Medicare Advantage carrier, and typically they're going to be HMO or PPO plans. And then for veterans, a lot of times what happens is because TRICARE and VA covers medication that is considered credible coverage in the eyes of Medicare, most people are getting their medication through TRICARE because it's less cost, or they're just used to that. They've been going to the VA for years, getting their medication, and they're looking at keeping that like that. But they're looking at, hey, I've heard that some of my friends have a Medicare Advantage plan or a military plan sometimes, or a VA plan. What is that? What is the benefit of that? And I want to explain exactly what those details are, why you should be looking at those options, and how that can benefit you in the long run when it comes to coordination of care, when it comes to your, whether it be TRICARE for Life or your VA benefit coverage. So often, if you're getting your medication with the TRICARE benefit that you have or the VA benefit, you're going to be looking at a Medicare Advantage, what they call MA only, which does not have drug coverage. And often you're going to see these MA only plans are going to have names like, it'll have a carrier's name with like Patriot plan, or carrier's name with like Eagle plan. You're going to see that these MA plans are kind of patriotic in name. Well, the reason they did that was, one, for years, they used to say Medicare Advantage plan does not coordinate coverage with TRICARE. Well, that was false. What happens with original Medicare, it sets its primary coverage and it bills over to TRICARE. Your Medicare Advantage plan works the same way. They're sitting in first payer position. So if you go to a doctor with a Medicare Advantage plan, you typically are going to have like a zero copay or small copay. And if there's a copay amount, they actually have a form they can fill out that sends over to your TRICARE VA, and that coverage is going to pick up the rest. So just like original Medicare, when you have the bill sent over to TRICARE coverage or your VA coverage, it picks up, it's basically like 100% coverage. So I like to say we're going to cover all the Part A and Part B services that your Medicare or Medicare Advantage plan covers. And anything that's left over for copay costs is going to be picked up by your TRICARE for Life or your VA benefit. Now, access to care through VA is a little bit different than TRICARE for Life. And I won't get into the nuances of that to keep this simple. But why are people enrolling into Medicare Advantage plans, and what's the benefit of you looking at these options? Well, one, Medicare Advantage plans often will have a Part B buyback. So this may mean $100 of your Part B premium is paid down. Right now we have a $202.90 standardized Part B premium. And if $100 of that is bought down, that gives you $1,200 of additional income paid into your Social Security. That's one option. The second option is most of the MA plans are going to have some additional like dental, vision, hearing, over-the-counter benefits. So a lot of times a person is looking at, hey, I want the Part B buyback. I also want some additional benefits that maybe my military retirement does not cover, or access to that is easier through the Medicare Advantage plan. Now, with that, a lot of times, if you're in an area in Middle Tennessee, we have very, very nice detailed MA plans or very robust Medicare Advantage plans. So if we're talking to a TRICARE beneficiary, the things that are most important to think and consider when enrolling somebody into a Medicare Advantage plan, or if you're enrolling and looking at options, is you're still going to be subject to network restrictions. And what does that mean? That means if you enroll into an HMO, Medicare Advantage plan with your TRICARE For Life, that HMO is going to have a list of doctors, specialists, hospitals, and facilities you're able to access care. And then with the additional cost, if there's a copay cost left over, your TRICARE is going to pick up. So it's very important to do a couple of things. One, decide, okay, I go to the VA and I access care. Even with TRICARE For Life, I'm still going to the VA. There's people that live here in the city that go to the military. Their doctor that's been there for years, they just access care. They're not going to go outside of the VA. But if you're going outside of the VA, you're subject to the Medicare Advantage carrier provider directory. Your primary care, your specialist and hospital have to be in network with that plan for that plan to work. And then any additional cost is going to be billed to your TRICARE, and TRICARE will pick up, or the VA will pick that benefit up. So the most important thing you need to be able to look at is, does this plan cover my doctors? Am I getting medication through the VA? Or if you want to get medication through the Medicare Advantage plan itself, you can still pick up a Medicare Advantage prescription drug plan, an MAPD plan that covers drug benefits. Some of those plans will have a smaller buy down. Most of them will have dental, hearing, vision, over-the-counter benefits. One of the other big benefits that it pays for is a health club membership. Often these plans will have some form of silver sneakers, silver and fit, and people don't want to spend $50, $60, $70 to have a health club membership. So if you have a $100 buyback, a $50 health club membership, and then it provides some over-the-counter quarterly, it may be $100 every quarter. So that's another almost $200 of benefit that plan is providing that original Medicare does not provide. So what does that accumulate to? It can be $2,000, $3,000 of additional income savings for that Medicare beneficiary that's a TRICARE and or veteran itself. And the age-old question really comes down to this. Does TRICARE and VA coordinate with Medicare Advantage plans? The answer to that is yes, but the caveat of that is original Medicare doesn't have a network, so the doctor that accepts original Medicare's fee-for-service that's going to bill to TRICARE, that's how original Medicare works. You just need to make sure if you're enrolling into a Medicare Advantage plan that you're going and accessing care with the network, with that Medicare Advantage plan intact. Okay, so your primary care doctor, your specialist, hospitals, access to care is going to go through the Medicare Advantage plan's network. And then the billable items will be sent to TRICARE, and TRICARE will pick up. If you have additional questions, guys, we would always encourage you to be able to call in, schedule a time to be able to talk to one of our licensed professionals. I'd love to be able to guide you through. And as we always like to say, we're here to make your life easy by making Medicare simple. If you have a complicated question about TRICARE or VA and we haven't covered it in the video today, call in. We'd love to be able to answer those questions for you. Until next time, I will see you on the other side.